Dr. Clint Semrau from Aspirus Medford Hospital and Clinics. What's the current procedure at the clinic and hospital, Doctor?
At this point, we're taking a lot of precautions and been doing a lot of research and talking to other communities and establishing some plans to start bringing some of our normal or more routine health services back online. Being careful with the whole COVID situation and the social distancing practices. So we're starting to see some semblance of normalcy, albeit in a very different fashion what people have seen previously when they come in for their visits.
What will people see different when they come in for a visit?
Really the biggest change, just walking the door, is we have a screening now. We're checking temperatures and some basic questions just to see if there's any risk for exposure. We are separating patients into smaller groups and smaller areas to allow a little more distancing to occur. We're separating some of our sick versus our well patients and just being much more cognitive of how people are interacting overall, much like we're doing in our everyday lives at this time. And in some services, such as surgery, which is what I'm heavily involved with, it actually has testing that's being done and even further precautions to minimize risk. People are being asked to wear a mask when they come in. If you don't have a mask with you, we actually supply some masks that we have available at our front desk. Our staff are all wearing masks. So just very different than what you have seen, say, 3-4 months ago before all this started.
How do we go about setting up our appointments again?
Yeah, we're offering several ways to do that. One is we're slightly separating our times, extending our times just to keep more room turnover, keep our rooms really clean, even more so than we've done in the past. Also, we have e-visits and televisits and using technology to our advantage, which we've had a lot of patients already take advantage of. And at this time, we have kind of a low prevalence or concern in our community, and we're taking a lot of precautions that people who have things that could be more of an issue if we ignore it, say diabetes or something more of a chronic disease management, if they feel comfortable coming in, we're making accommodations to do that with as minimal risk as possible. People who have even just an annual exam, if it's something you're at the point you're ready to get done, we have a way of doing that and offering that as well at this time.
So your advice, Doctor, to those that want to maintain their health during this time?
Same as, always, eat healthy, get plenty of rest, exercise. Now we have nice weather finally, so getting outside is definitely a good thing. It's kind of the things we're always too busy for or take time to do properly, but that's kind of the basic rule for probably 80% of our health care. Beyond that, if you're at a point that you have something chronic or something that's been bothering you for a while, if it's at the point it's starting to have effect on you and you're concerned, it's time to get taken care of, because a simple thing to take care of nowadays or today could be a bigger issue down the road. So just being aware of that. And we also have a lot of people who are just not quite comfortable to come out yet, and we'll do what we can to help you over the phone and some of the telehealth. But if it's something you're not comfortable doing, it's definitely everybody has to make their decisions. And a big piece of just the COVID in general is recognizing what your own risk is and your environment around you. So dealing with the COVID piece, if you have to go to the grocery store, kind of go during a time where it's less busy. If you're somebody who's immunocompromised or taking care of, say, a loved one with cancer who's on chemotherapy, taking extra time to wash your hands, taking extra precautions for distancing, minimizing your visit, make a list so you're not going to the hardware store 6 times in one day because you're doing a project somewhere. So really just taking the extra time to think about how we do our daily activities goes a long way for general health as well as the COVID environment we're dealing with today.
Bottom line is Aspirus is open and ready to go for appointments?
Yes, it's going to be a phased approach, too. It's not we flip the switch and everything's back to normal and just get on with our lives. It's incrementally done. We're doing in slow pieces each week. We bring back a little more, and we're constantly monitoring. We did have one positive patient in Taylor County finally, so we watch that very closely. So we do ask patients be understanding if we have to change some appointments, if we start seeing trends in the community that are concerning that we need to take precautions or consider. We are being somewhat fluid with this as well, too, at this time.
Dr. Clint Semrau from Aspirus Medford Hospital and Clinics.